Dr. Paul here. We've got a baby to see. Hey, how you guys doing? So how many days old are we?
4.
4 days old?
4 days old? Yeah.
Fantastic. You gonna open your eyes? It's too warm and cuddly to open your eyes probably. There's a big yawn. Yawn, yawn, yawn. Sometimes it's too bright. I'll start with the heart. All right. Heart and lungs sound great. There we go, a little red reflex. Picking the ears. That one's perfect. That one's perfect. Nice soft spot in the mouth. So that tongue moves enough that you can see under that tongue just fine. Hey, hi. All right, so let's just see what that suck looks like. Are you thinking you might try to directly nurse, or you just want to go straight bottle?
No, I want to do directly nurse as well.
Okay. I would recommend visiting the lactation people.
Yeah.
Because they're kind of the masters at helping with getting that latch to work.
Yeah.
Right now on my finger, she's sort of clamping down a little bit. Kind of like, you know, which might be a little tough. The lips are sort of a little curled in. What I'm trying to do is work my finger to the back of the throat, which she's like, wait a minute. But fortunately, there's no gag. She's sort of accepting it. Come on, suck away. You can do it. You can do it. How long ago did you feed?
Before we got here.
Just before you got here?
Yeah.
Yeah, so she's like going, I don't need to eat. There we go, there's the sucking. I think she'll get it. Oh, I'm sorry. So that did you see that little that's a startle reflex. It's normal. Parents will ask, like if I hold the hands up and let go, they do this. See that? Yeah, that's not a seizure. Some people will ask, is that a seizure? No, it's just there. You see that? That little. That's called an intention tremor or a startle reflex, and it's a normal thing. Babies neurologically are, you know, I mean, they're just getting everything wired and connected properly, so it's easy for that to happen. This is a normal grip reflex on my thumb. See, she's holding my hand. Oh, it's so cute. It's so adorable. Hi. Yeah, you're very cute. Yes, you are. Hi there. So looking at the whites of, bless you, bless you. Looking at the whites of the eyes, there's a hint of yellow. We call that scleral icterus. It's, yeah, just, they're not quite white like the color of this blanket white. They're a little on the yellowish side, just a tinge. The skin is a little on the yellowish side. No, actually, I'm less concerned now that I got a good look at those eyes. I'm less concerned. So this baby we're seeing is a little hairier than most, and that's just ethnic. And I didn't want to bring it up in front of the family, of course. My wife's Hispanic, and those of us who are Hispanic, which I'm not, will have hairier babies for sure. So that's just something to be aware of, nothing to be concerned about. So in the hospital, right after birth, these little clamps are popped on there to pinch the blood vessels on the cord so that it stops bleeding. Because obviously babies are connected to mom through the umbilical cord, and that's how they're eating. And so those blood vessels need to be tied off or clamped off. And that's all this is. This is sort of modern day. And this just cuts it so we can take it off. So oh my goodness. Oh my goodness. Oh my goodness. Oh my goodness. Oh my eyes. I'm sorry. Sorry, I was just, yeah, those, getting a closer look at the whites of the eyes, and they are looking a bit yellow. So we'll check a bilirubin today. So on the cord here, you can kind of see there's some white goopy material right in there. That is an umbilical granuloma. And I'm gonna get a little silver nitrate stick just to dry that up, because it's kind of goopy and bleeding where the cord is. So I'll go do that real quick, and we'll just zap it right there. Okie dokie. It's getting in the way. I've got my finger now, like solid. You have a pacifier by any chance?
Yeah.
Okay, let me grab that because we seem more content when we're sucking. This is silver nitrate, and it just dries up that umbilical stump, what we call the umbilical granuloma. And so we're just gonna touch this here, and chemically it dries it up. Oh, I'm sorry. Oops, bumped you. So that looks drier now. I don't think it'll be as likely to bleed or get infected. So folks, we've got this amazing baby who's got a little bit of an umbilical granuloma. You got to see that cauterized. We've got a little bit of yellowish on the eyes, sclerolicterus, and slight yellow on the trunk, which is representing that high bilirubin, hyperbilirubinemia, or jaundice. We're gonna recheck that, and we're like 4 or 5 days old? Yeah. 4 days old. If the bilirubin's over about 16, you would go back to phototherapy, which is the light therapy. I'm guessing we're gonna be fine. It's gonna come back around 13, 14, which is no big deal for a 4-day-old. A 1-day-old at 13 would be very alarming. It goes up for the first 3-4 days, levels out, and usually leaves the body in the first couple weeks. Thanks for watching. I'm Dr. Paul.